Good afternoon. I'm Louise. I'm clinical nurse specialist at Leeds Teaching Hospitals in tissue viability. I just want to share with you our experiences over the last 12 months. We actually undertook an evaluation of a hybrid mattress on one of our acute oncology wards over an 11-month period. In terms of as a trust, we currently have 1,722 beds with a variety of specialities. Obviously, we have the same concerns about pressure ulcers being harms. Approximately 4% of individuals experience harm from pressure ulcers in acute trust, so it's a concern for us, particularly as Tissue Viability Service and Trust. We currently use high-spec foam mattress, and we have a rental provider for the dynamic mattresses. The trial came about because we currently have a pressure ulcer collaborative group as part of a quality improvement programme, and we have 16 wards currently involved in that in terms of pressure ulcer prevention. They're following a variety of different methods. Some of them are using clocks, some of them are repositioning from side to side, and the oncology ward were interested in trialling the hybrid mattress. So we got together with the mattress provider and the ward manager, and obviously we discussed going forward the trial. We had commitment from the clinical advisor from the mattress company, Tissue Viability, the ward manager and the ward themselves. And over a period of time, what happened was that we put a 2-week teaching programme in place, and then that covered days and nights, drop-in sessions, and to get a clear understanding to make sure that staff were clear about when they needed to step up from a hybrid mattress to a dynamic mattress. We then, over a 3-week period, opted out the foam mattresses and opted in the hybrid mattresses. On a daily basis, the advisor from the mattress company checked on the ward, and Tissue Viability did ward walks. I have to say, for the clinical advisor in the mattress company, it wasn't without its challenges, because obviously the trial was only on one ward, and she kept having to go and grab the mattresses back to make sure they didn't disappear off with the patients when they were transferred to other areas. So that was one of the challenges. Okay, so the aim of the trial really was to see whether we could sustain cost-effectiveness, but also at the same time releasing nursing time to care. Nurses seem to spend a lot of time, don't know about you, not only doing bed moves but also mattress changes from foam mattresses to dynamic mattresses, so it was hoped that with the hybrid mattress some of that may reduce. In terms of risk assessment of the patients on the ward, we followed Purpose T risk assessment tool, obviously identifying green for those not at risk, your amber for patients who were at risk but didn't currently have any pressure damage, and patients who did sustain pressure damage. In terms of findings from a cost perspective point of view, from 2017, dynamic mattress systems over a period of 3,364 bed days equated to just under £10,000. For the same period in 2018, what we found that there was less usage of the dynamic air mattresses, resulting in £2,500, which resulted in a 75% reduction and a cost saving of 75% against the previous year. We then went obviously and evaluated at the same time the pressure ulcer outcomes. The previous year we'd had 21 hospital-acquired pressure ulcers on that ward area, which equate to 136,000. Last year, over the same period, we had 10 pressure ulcers that equated over to 76,000. Now, we did have a category 4 pressure ulcer during that period, but the patient actually sustained that while they were in the wheelchair, not whilst on the mattress. There was, on the investigation, the patient was quite complex, and there were a variety of concordance issues. The reduction in pressure ulcer damage showed 50% of hospital-acquired pressure ulcers and a 40% reduction in cost, which resulted in saving of 60,000. And so that's just sort of on one ward that we've evaluated this. We did hand out staff and patients an evaluation, and again that was one of the challenges, getting the staff to sort of fill in the evaluation form themselves and with the patients. So there were between 36 and 38 evaluation forms completed. In the main, staff found that there was an improvement in simplicity of use, ease of handling, ease of cleaning, and they felt that there was an improvement in patient comfort. From the patient's perspective, their main two positive experiences really were the comfort and ability to mobilise and change position on that mattress. So in conclusion, obviously pressure ulcers represent a significant burden to patients, carers and healthcare providers, and it's believed to affect 1 in 17 patients. Pressure ulcer prevention is expensive, but it's more cost effective to prevent than it is to treat the pressure ulcer, based on the burden to the patient, the carer, quality of life, pain, exudate management, dressings management. There are obviously a wide range of pressure ulcer redistributing systems available both in community and the acute trust. Obviously from the evaluation we did find overall that there was a 75% reduction in our dynamic mattress usage and a 52% reduction in pressure ulcers. What the evaluation would still suggest is that although there is a place for hybrid mattresses, it needs to be based on individual patient assessment, it needs to be based on their ability to reposition, the risk of the patient, and for your high-risk patients, it's still widely accepted that we need to continue to use dynamic mattresses. Going forward as a trust, we are still continuing to evaluate the hybrid mattresses, and we've currently moved the evaluation to a surgical ward, and then we're going to look at an acute medical ward later on in the year. Okay, thank you.